Welcome to the webinar today, Public Policy for Equity and Healthy Aging. So I'm Diane Oikle, and I am a Knowledge Translation Specialist with the National Collaborating Center for Determinants of Health. And my task today is really just to set things up and to introduce. This is a joint webinar in complete partnership with Health Promotion Canada. And, you know, the highlight is on those folks and their wonderful book, Promoting Health of Older Adults. We're planning actually to do an entire webinar series to highlight various aspects of equity and older adults related to public health, community health over the next 6 to 7 months. So before I go any further, I do want to acknowledge with thanks that the NCCDH is located in Mi'kmahi, which is the ancestral and unceded territory of the Mi'kmaq people. I am in Antigonish, Nova Scotia in Mi'kmahi. I won't say much about NCCDH. This is a link to the 6 national collaborating centers. This is a little bit about National Collaborating Center for Determinants of Health specifically and what our focus and work is. You can get in touch with us through that website, but you're also very welcome to get in touch with me directly. And in a couple of minutes, I can pop my email into the chat box. So with that, I will ask my friend Irving Rootman to come on and say a few things. Irv?
Thank you, Diane, and hi to everybody else. I want to start by acknowledging that I live and walk and learn on the unceded traditional lands of the Musqueam, Salil, Watuth, and Squamish Coast Salish people. And I'm now speaking from that land. I want to welcome all of you on behalf of Health Promotion Canada, an organization and a community of people across Canada who aim to advance the practice of health promotion and have organized a number of webinars in partnership with the National Collaborating Center on the Determinants of Health over the last few years. And I want to thank Diane and everybody at the National Collaborating Center for supporting this webinar and the other webinars that are following. As Diane has mentioned earlier, I'd like to thank you for taking the time to join us today, knowing how busy you are during this long COVID-19 pandemic. I'd also like to welcome you on behalf of the editors, the contributors, Canadian Scholars Press, publishers of Health Promoting the Health of Older Adults, the Canadian Experience. Some 35 years ago, the Ottawa Charter in Health Promotion was created and has served as a global framework for promoting health for all ages since that time. The book and this webinar series is organized around the 5 action strategies listed on this slide in the Charter to promote health, well-being, and equity for older adults. Today, we're going to take a look at the first of these strategies, namely building healthy public policy. And we have 3 knowledgeable presenters who will address building healthy public policy for equity and aging.
And this is a bit about the objectives of our conversation today. And this is a bit about our speakers. We have 3 speakers today. We have Peggy Edwards. Peggy Edwards, I'm just looking for the bio. So Peggy is a co-editor and a contributor to Public Promoting Health for Older Adults. She's a health promotion consultant, policy analyst. She's a writer who specializes in issues related to aging, social justice, volunteerism, and gender. She's worked with Health Canada, Canadian Public Health Association, World Health Organization. She's authored 3 best-selling books on healthy aging and grandparenting. She's active in the Grandmothers to Grandmothers campaign, which supports African grandmothers who are raising millions of AIDS orphans, and a co-founder with Grandmothers Advocacy Network. And she has received the Ron Draper Award for Health Promotion. So very esteemed lead speaker. We also have today with us Jim Hamilton. And for over 45 years, Jim has provided leadership and advocacy to build supportive and inclusive environments. He's worked with Manitoba government, University of Manitoba's Centre on Aging, Public Health Agency of Canada, World Health Organization, and he continues to work and share experience with government agencies, older people and their organizations to promote healthy aging, develop age-friendly communities, and combat ageist attitudes. And Jim holds a Bachelor of Arts in Rec Admin from the University of Alberta, a master's degree in therapeutic rec, and a second master's in public policy management from Oregon. It always amazes me when people have more than one graduate degree. That's pretty awesome. And so we also have Sherry Torman, who's the vice chair of the Disability Advisory Committee that reports to the Minister of National Revenue. She was vice president of the Caledon Institute of Social Policy for 25 years. She has published extensively on a wide range of policy areas, including child benefits, disability income, supports, caregivers, welfare reform, community-based poverty reduction. She has worked for the House of Commons Committee on the Disabled, House of Commons Committee on Childcare, and the Royal Commission on New Reproductive Technologies. She's received numerous awards for her policy work and is obviously the policy expert, a policy expert here. And she has also been named one of the top 25 Canadians award from the Canadian Association of Retired Persons. So her expertise is extensive. So this is your group of presenters today, and I just feel really humbled to have you all here. Thank you very, very much. And with that, I think I'm turning it to Peggy.